And I think we'll get started as folks continue to trickle in. So welcome everyone, good morning. My name is Alex Beck and I am one of the co-hosts of the Southern Vermont New Vermonter Providers Network meeting. This is an initiative that we're working on with our partners in Windham and Bennington County, in partnership also with our leads of our state agencies that work most directly with our new Vermonters. And I'll give just Sue and Adam just a brief chance to introduce yourselves and welcome folks if you'd like.
Thanks, Alex. I'm Sue Graff. I'm with the Agency of Human Services. I'm what's called a Field Services Director, and I serve the Brattleboro and Springfield districts. And we have a role to play, as the name implies, sort of helping assure that Vermonters, new and and old, I suppose, are served well by our systems and our community partners. And so we are a resource to you all around how things are going in the new Vermont community. We can help you connect to available resources, understand how the state buildings and offices are structured and who to talk to for what. Many of those folks are on this call today as well. So we want to help build those relationships directly, but we are also a resource for you if you have a question about the Agency of Human Services and how we operate and what we do and how we can serve the folks that you serve as well. So, and I'll pass it to my colleague, Adam.
Good morning, everyone. I'm Adam Sancic, the Field Services Director that covers both Bennington and Rutland County. It's nice to see everyone.
Great, thanks. So the next part of our agenda is very briefly around the purpose of this meeting and the goals that we really have. And I think Sue almost mentioned it earlier, is that we have an existing set of programs, supports, resources here in Vermont that really is excellent. We've got folks in every corners of our communities working to better support Vermonters. And so our goal for this meeting is to ensure, as the people who engage with new Vermonters, whether they're asylum seekers, refugees, or just folks new to the community, that they know how to plug into these resources, that we're not creating more silos. In fact, we're breaking those down, and we're really ensuring that when and if there's an issue or an obstacle or a need in the new Vermonter community, that we as both providers of those services and as case managers and just the people who maybe spend the most time with these individuals, we know where to send them and what resources to provide them. And so, again, I'll mention we record these and we'll publish them on YouTube and share those links. Today, our focus is on housing support, the VERAP program, and maternal and family health. This may be very relevant to the work you do. You may not think it's relevant right now in thinking about it, but again, one of the goals is, as an example, you're just working tangentially with a family, and you know that they have a newborn. Do you know the person in the room now to connect that person with? And so even, especially if it isn't your job to work in maternal or family health, this is maybe the best one for you to attend. And so that's really, I think, the ethos and philosophy of why we're trying to convene. Any questions on that before we start with some state and regional updates? Great. And so first, I would like to, I need to consult my own agenda, introduce Joe Weah. He is the Executive Director of the Ethiopian Community Development Council. We tend to start these meetings just with an update from our immigrant and refugee and asylum seeker support organizations, the ones who are really on the front line of welcoming these folks and supporting them. And so without further ado, Joe, do you have any updates? What's on your mind these days?
Thank you. Good morning, everyone. I want to begin to thank you all for all your services you've been providing. I know for us now, it's been 9 months since people arrived, and it's been a learning curve for all of us, and you all have been providing services to refugees. So thank you for that. My update is a very short this time. As you all know, the Afghan placement program has come to an end, so we are not receiving anyone through that program anymore. So all those who are coming through the reception and placement, which is a regular refugees program. As of the last time we met to this time, we received 17 people, 5 families and 4 singles. One family from the Congo, but unfortunately the family from the Congo left the state this weekend to go to Michigan. We have a family from Guatemala arrived, a family of 3. And also we have the rest of our arrivals came from Afghanistan. We expect to have 1 new arrival coming this week. And that person is coming from Afghanistan as well. That person is not going to go through SIT because they have a family connection here, so they will be directly connecting with their family already in Brattleboro. We have not had any walk-ins since we last met. Currently, we have 6 people on the SIT campus, hoping to find housing for them. As you all know, the housing on SIT is also being supported by VERAP. So now VERAP is coming to an end. It's a very challenging thing for us now. We know that the housing will continue on the SIT campus up to hopefully June of 2023. But we also have to now, after that period, continue to discuss with SIT how we move forward with that. For VERAP, I know that today's discussion is on housing and maternal health. So for us, since the announcement of the VERAP, we know that 9 of the recent arrivals will be affected by the VERAP closure because VERAP was very helpful in terms of transitioning people into permanent housing. We have 27 singles that would directly be impacted by the VERAP program. We know also all our families from REACH-UP who are on REACH-UP at some point might be affected, but currently the impact will be on 27 singles and family without children under the age of 18. For legal support, we have roughly for our legal support, we have 23 cases that are interviewed already and are waiting for a decision to be made. We have 5 cases that we need to submit for the adjustment of status. And we have 18 cases on SIV in the SIV process. Most of our SIV cases, we haven't gotten to them yet. But most of our adjustment of status cases have already been interviewed and waiting for decision from USCIS. World Learning continue to provide English language support to refugees and also for employment. BDCC continue to provide employment, and the BDCC is here, so I'll leave it with BDCC if they have any update on that. But from what I have here, we have of the 107, we have about 44 adults that are employed. For the Ukraine crisis, we are in the process of hiring an Irish person that will be reaching out to 4 counties that will be covering, and those 4 counties are Windham, Windsor, Bennington, and Orange counties. And we have the zip codes of where we expect people to be. So the Irish person will be reaching out to those zip codes. But at the moment, we have Mark Clark, who is our resettlement program manager, as the contact person. So if there's a question regarding Ukraine clients, please feel free to reach out to Mark. Our community center continue to operate. It's still open and operating fully. So if you want to organize any activities to reach out to refugees, please feel free to reach out to Jill. For health, we received a grant from the state to do outreach for mental health, and we're working closely with ACRS as a referral partner. So ACRS will be providing most of the clinical support. We would be doing most of the outreach component of that. For domestic health assessment, we still have some cases to complete. And Camila, our health navigator, will continue working with Ali to make sure that those cases are scheduled. So far, that's it from my end. That's the update I have here, and I'm open to question. If you have a question for me, you can put it in the chat room. Thank you, Alex.
Thank you, Joe. And I think one thing that's important that Joe mentioned is that the way new Vermonters come to our communities is in a variety of different ways. You know, he mentioned some folks can just walk in, and if you're a refugee, you can, you know, just become a part of a community. And so as providers, you actually may be the first person to interact with a new Vermonter and be able to refer them to whether it's ECDC or CASP or another organization. So again, there are new Vermonters in our community who may be eligible for additional support that we don't even know about yet. And you may be engaging with those folks. So I really appreciate, you know, Joe saying there's outreach being done to find Ukrainians and others. The same can be said for you as service providers, just making sure, are they connected with all of the variety of folks in the region? So thank you for that. And Joe, there's a question in the chat around the mental health outreach for Bennington County. Is HCRS doing that also?
No, so we will be doing most of the outreach for mental health support and do a referral to ACRS.
Okay. Great. I think specific questions around that can follow up with Joe. Great, thanks. Sorry, I was muted. Next, I believe I saw Dora and Christy on the call. And thank you, Tracy. HCRS is for both areas. So Dora and or Christy, if either of you want to provide an update on how things are going at CASP and what you're thinking about this month.
Yeah, hi everyone. I'm Dora. I work with CASP as the case manager. So an update on CASP. We have 18 asylum seekers. And here, when we talk asylum seekers, they're really very different from refugees. So we have people from Africa, Rwanda, Ghana, Congo, Brazzaville. And then we have folks from Mexico, Honduras, Cuba, and now we have a family from Haiti. Yeah. So we work on like a legal aspect. And these days, I think you guys have seen it in our newsletter. We are working on a legal project to train legal and paralegal people to fill the gap of really legal representation for asylum seekers and refugees. And we are working on our folks enrolling in English classes and computer classes in partnership with ECDC through MCC. But we are having challenges of like not having same level of, you know, Afghan who just came, maybe they're really on the level of learning how to write like alphabet and all that. And then our folks having, and we've talked about that they will be moving to another level class, like level 2 or intermediate. That's fine. But we do really appreciate the partnership with Vermont Adult Learning and SAT through the ESL classes. So we are working on finding a job, but this is also another challenge. It's like the USCIS has said that work permit will take like 30 days, but now it's some of our folks have applied since June, and we are waiting for work permit to come and the folks can join other people to start working. So that's an area of, there's nothing else we can do. I think it's more dealing with the system, how the immigration is set up and setting up days to wait for a work permit. Yeah, maybe more challenge also is like the mental health as usual as for other people. So we have few people who are like therapists who speak Spanish, and that's the most challenging, yeah, for us. I think, Christy, do you want to add something else?
Do you want to talk about VERAP? We don't have to, but
Yes, thank you so much for reminding me. Yeah, as everybody knows, yeah, VERAP is ending, and really most of our folks were in VERAP, and I hope really to hear something from VERAP, but we are really educating and reminding our folks to be ready to move or to shift from being supported by VERAP to being able to pay rent and all the utilities. So we've been having meeting with them, telling them how much is VERAP gonna pay like for this remaining month. Like October is 70% of the rent, and November 50%, and then end of November it's ending. So we are working on that to be able to look at the budget and see if our folks are able really to pay rent and to sustain themselves and put really food on the table. So yeah.
Great. Thank you, Dora. Yeah, well, today's focus is really on understanding the facts around VERAP and really what those deadlines are. I had hoped that we'd be joined by someone from Wyndham Windsor Housing Trust, but they have a staff-wide training today and we're unable to attend. So I imagine there being follow-up on this conversation soon with what happens after VERAP, but today we have someone from VERAP to present and hopefully answer any questions and clarify. So thanks for that. Last but certainly not least, we do have Tracy Dolan here from the State Refugee Office. And Tracy would love an update with what's going on statewide.
Sure. Thank you so much. Always happy to be at this meeting. So just a reminder, I'm with the State Refugee Office. We're an office within the Agency of Human Services. Right now, Vermont has 2 refugee resettlement approved sites as per the State Department, and that is in Colchester and in Brattleboro. But as you know, the resettlement agencies, ECDC and USCRI, did put in a proposal to open up sites in Bennington and Rutland. As you know, they were already doing work there, but because they're placing staff there, they are hopeful that the State Department will officially designate those as sites, in which case then we would have 4 official sites here in Vermont. The refugee program is now becoming more healthy again nationwide, which means we are receiving people into the United States, and folks are then getting sent to communities. I think I mentioned before, the way that works is the 9 major resettlement agencies nationally meet together and determine which resettlement agency is going to get whom, and then reach out and work with their state affiliate offices to determine who's going to take whom. So we've had a trickle of refugees coming in both to the Brattleboro office and to the Colchester office for that purpose. In terms of funding, my office received, so most of the funding that my office gets for the resettlement work comes through the federal government. And then mostly it goes out through refugee support services. So it goes to the resettlement agencies or to schools. I get school impact money uniquely, or it may go to another particular agency if it's earmarked, like the mental health money that you just heard about. My office gave a grant both to ECDC and to Healthcare Rehabilitative Services, HCRS, in order to do that mental health work. And the scope of that work is for the Brattleboro and Bennington area. So they will be partnering in Bennington as well, HCRS will. But another avenue that came through was through the state. The legislature designated $500,000 for 1 year only. And they put it quite broad. It was for aid to refugees, but the conversation was around retaining people. So a real interest that when people come here, they stay. So a few organizations met together and said, what are the obstacles for people staying? And the big ones were vocational training, getting jobs at a rate that makes it affordable to live here. English language instruction, again, that's an obstacle to getting a good job. Folks do come here with some skills, but sometimes can't get the job they want because of the English language. And then a third area we noted was the housing costs, which of course are high for many Vermonters. So out of that 500,000, 300,000 went out in a request for proposals focused on vocational training and English language. So we've got proposals coming in and we'll see what is recommended or proposed there. The additional 200,000 I held because I had heard that VERAP was ending early. So I'm going to be meeting with folks around how we might be able to utilize that 200,000 to assist between December and June. For folks who might be coming off VERAP, we won't be able to cover all costs for everyone, but we may be able to come together and say, okay, how will we determine highest need? And how might we be able to help maybe with a portion or some step down kind of system. And again, not uniquely just for refugees, but for all of those in that Office of Refugee Resettlement category. So it's refugees, it's asylees, victims of trafficking. There's sort of a set, humanitarian parolees. And so anyone showing up in the last 5 years in that designation, we'd be looking at. And so CASP will invite you to that. That'll happen in a couple of weeks where we'll come together with the resettlement agencies, CASP, AALV, a couple of the key players who work mostly with folks, helping them find some housing. And we'll figure out, is there something we can do with small grants to the agencies working with folks to assist with a little bit of help there. And then the other area I just wanted to update on was the Ukrainian situation. So we continue to have Ukrainians coming into the country. We still don't know how many are here in Vermont. Ideally, they would register. They'd reach out to my office or they would register with ECDC or USCRI, both of whom have some funding to assist them. However, they don't have to register. So right now we have about 30 overall registered, but we know that at least 93 have applied to come to Vermont. However, we also know that there are people coming from out of state who didn't uniquely apply to Vermont, but are showing up to be with sponsors here. It's a very fluid situation. And they're coming and showing up anywhere. The downside of that is they're not necessarily near a refugee resettlement agency, so it's not easy for them to get those services. So for example, we have what we believe is going to be a fairly high number of very high need children and adults up in the Derby area. So that school is actually going to be hit pretty hard. So I'm working with that school right now around school impact funding that's uniquely just for Ukrainians. So we've got some Ukrainian funding to support uniquely for Ukrainians. And we're looking at that. The resettlement agencies also letting folks know, hey, register with us and we can help you at least sign up for some benefits. The Ukrainians will get most of the benefits that most refugees would. They wouldn't get that specific help in the first 90 days with finding an apartment, things like that, getting picked up. That's all sponsors. But some of the other services they are eligible for. So that's where we are right now. And legal, just touching on legal as well. We will get more funding to support, again, only Afghans, which is very specific and not ideal, but we will get more legal money to support only Afghans on their immigration related legal needs. And we expect that to come in again, probably in October. All right, thank you.
Great. Thanks so much, Tracy. The last thing I'll kind of mention here is that part of my role at the BDCC is to help coordinate the variety of folks working on different specific topics. So legal aid is a great example of there's resources available for Afghans. CASP is developing a really exciting network of folks. And as an organization, we will start convening the providers of these services specifically to make sure everyone's covered. You know, it's not up to one organization to serve all new Vermonters, but I think, you know, part of our goal is to ensure no new Vermonter goes unserved. A similar thing can be said for ELL. For those who are interested, we have an entire working group that, you know, Windham and Bennington County around ELL services because we know it's so important. And so that's another monthly meeting for if anyone's interested in joining more meetings, you're more than welcome to. But those meetings are recorded also. So again, coordinating all of these services is something that is as important as finding more funding to make sure more services are delivered, to make sure everyone's covered. Dora, I see your hand up.
Yeah, thank you, Alex. Yeah, I just want to apologize for like focusing on challenges, because it's not that we don't have really success stories, but it's that really we as CASP working with asylum seekers, it's really a very challenging process compared to refugees. So as Tracy Dolan is here, I would like to advocate for our asylum seekers through some really fund like subsidy, like Section 8. I heard that VERAP may really, you know, transfer some file or some people to benefit from like Section 8. And, you know, asylum seekers are, some asylum seekers are not really eligible for Section 8 because of their immigration status. Yeah, I just want to really, yeah, address this to Tracy so that our asylum seekers can really benefit from it if they are not yet really eligible, like immigration status or granted asylum or green card. If they could be part of really that benefit, that would be really helpful.
Thank you. I can't probably address any of the VERAP policies. That's outside of my part, but the small amount of funding I have that could assist with housing support between now and June, I'll invite CASP into that meeting so that we can look at broadly at people who have been here in the last 5 years.
Thank you.
Yes.
Great. And I will share a success story that I'm excited. Today was the first day of a construction for new Vermonters course. And so that's something that the BDCC and CASP and ECDC helped work on. And it's just an exciting, you know, around ELL and vocational training, big topics that we're talking about. So that's a small success I have to share, of which I'm sure there are many great successes that's happened in the last month. So I'll end that little update on an exciting note. And I think now is a good time to transition to talking about VERAP. Again, this is really an overview of the program, so we're all on the same page and understand what's next and well, what's now and what's next. And so I'm excited to introduce Diane Nelligan, who's going to share with us. And I think I need to make you a co-host so you can share. Welcome, Diane, and thanks for being here.
Thank you. Thank you very much. I'm happy to be here today, and hopefully we can do some level setting on where we are with VERAP and how we can move forward. I'm going to share my screen. That's not what I want. So that
I can see, but I can't hear you. Is that a similar issue for others right now?
Yeah, I think she inadvertently muted herself, so, or somebody muted her, so. She appears to be on mute.
okay. Can you hear me now?
Like, we can hear you, but we can't see the presentation now.
Right. So it looks like somehow the presentation is getting interrupted. It's interrupting my audio for some reason. I'm not quite sure why.
Okay, well, what I can do is I believe you sent it to me this morning.
So can you hear me now? Maybe I can try again.
Yeah, if you want to try again, and if not, I can share.
Okay, let's try again. My sorry.
So it still seems you're muted, but what I will do is one moment.
Okay, so maybe you can bring it up, Alex. Is
Yeah.
that awesome?
Can
My
folks see
apologies.
the presentation now?
Okay, so
Yeah. Wait, can folks see the presentation, the VERAP slides? It's not perfect,
Yes.
but we'll make do.
Yep.
Okay, thanks.
Okay, so we're just going to go into an overview today of what is VERAP. How do you determine if a household is eligible? How to define risk of homelessness and financial hardship due to COVID. And then discuss a little bit how people can demonstrate their eligibility. I know there are a lot of questions around that. And then the final panel will be discussing sort of how VERAP is going to wrap up and what it looks like from 9:30 and beyond. So if we can go to the next panel, what is VERAP? VERAP, if we can move to the next one, is funded through the federal legislation. It was created to help Vermonters meet the financial challenges that they faced with COVID-19. It's amazing to hear the stories of how people were impacted. And I have to say, I'm sure I'm preaching to the choir here, that it impacted people in ways that were completely unimaginable. So for eligible households, the program offers assistance with rent, past due rent balances, utility and home energy costs, past due utility and home energy costs, and other expenses related to housing. This includes expenses related to evictions and court hearings and that nature. How to determine if a home is eligible. The first thing for VERAP, if we can, yeah, that's it. If we can go to the next page. So this program is VERAP, not to be confused with VHAP. VERAP is the rental assistance program. The state also offers another program for homeowner assistance. So I don't know if you have clients that fall into both categories, but there are two separate programs. Financial hardship, they determine financial hardship by determining if one or more individuals within the household has qualified for unemployment benefits or experienced a reduction in household income, incurred significant costs, or experienced other financial hardships due to COVID-19. We're seeing less and less of that, but there are still impacts out there. So we want to identify those, and we want to make sure that people get the assistance they need. Housing instability, applicants must demonstrate a risk of experiencing homelessness or housing instability. And then income eligibility. Households must have an income at or below 80% of the area median income. And that's going to actually play an important role in how the program goes forward. So this is important. The program in its entirety does not end after November 30th. For some individuals, it will go on until the funds are exhausted. So we can go to risk of homelessness. This can be identified who's currently homeless, has past due rent or utility notice or an eviction notice, is living in unsafe or unhealthy living conditions. They pay more than 30% of their income for rent and utilities combined, or any other evidence of risk as determined by the state. Financial hardship can be defined as one or more household members experiencing financial hardship due to COVID-19. They qualify for unemployment benefits anytime after March 13th, 2020, experienced a reduction in income due to COVID-19, had significantly increased household-related expenses due to COVID-19, or again, pays more than 30% of income for rent and utilities. Now, as some of you may know, some households automatically qualify for VERAP support based on their location. And that's what they call in the application the geographic proxy. So there is a calculator in the app itself. You can click on it, put the address in, determine if they meet the geographic qualifications for geographic proxy. Proving eligibility has become tricky. I think it's become more complicated as the program is reaching its end. So for income, if an applicant is not qualified by geographic proxy, then they must make a choice in how they're going to demonstrate their or verify their income. And this can be with 2020 or 2021 tax filings, proof of wages or income in 2020, 2021. So that can be maybe a W-2 or some other official form that shows that income. A statement of annual benefits letter from a government agency covering a period within 2020, 21, no earlier than January 1, 2020. So this could be Social Security benefits, disability benefits, anything where, you know, a government agency can provide a letter, you know, sort of establishing what that income looks like. So those are all proof of annual income. Then we go into proof of monthly income. So this can be pay stubs, wage statements, interest statements, benefit statements, or employer attestations. But for the statements, they all have to be one, you know, representing 1 month, and they have to be consecutive. So it can't be, you know, I'm going to take 2 from May and 3 from March or something like that. It really has to be, you know, demonstrating sort of consecutive months of pay history. The self-attestation should be sufficient. So if they can't find any of these other forms of verification in the application, in the documents page, there are forms, and one of them is an employment attestation form. And finally, we get to, you know, sort of where the program is headed after the end of this month. So, and here's where your AMI becomes very important. So for households with income levels between 31 and 80% of AMI, the assistance ends. This is the group where the assistance will end after November 30th for rental assistance and past due rental balances. Okay, so this, we're not talking about utility at this point. We're just talking about the rent. So on October, first of all, on December 30th, 2022, no new applications will be accepted by the program. So if you have people in the pipeline right now, work with them diligently to get the documentation needed to be able to submit those applications. No new applications will be considered after the end of this month. So for the month of October, assistance for this group of applicants will be reduced to 70% of the amount requested. So if right now VERAP is paying 100% of the rent, it will then pay for October 70% of the rent. In November, it will pay at a 50% payout, and then it will end after November. For households with income levels less than or at 30% AMI, the assistance provided, there'll be only one ramp down, and that ramp down will be at 70% beginning October 1st, and it will go until the funds are exhausted. So people in that most vulnerable category will have assistance through the end of the program as long as funds are available. Now we move to utility assistance. Assistance ends after December 31st for utility and home energy costs, balances, those arrears dating back to April 1, 2020. So anything provided that represents an arrears will be covered at 100%. But then beginning October 1st, assistance will be reduced to 70% of the amount requested. And all utility assistance will be closing out as of December 31st, 2022. So that doesn't mean December 31st, 22 comes and that's it, we're all done. It means any bills dated up to December 31st, 2022 will be paid at the 70% rate. Does that make sense? And then other housing costs, on September 23rd, VERAP will stop taking new applications for other expenses related to housing habitability repairs. On November 11th, all health and safety repairs must be completed and all documentation uploaded. After November 30th, applications will no longer be accepted for stipulation payments, rent into court, or money to move. And on the money to move, it must, the requests for those funds need to be within 30 days of the move-in date. Are there any questions?
One thing I do want to say before we dive in, I realize now that I reserved an hour time, but budgeted for more in our agenda. And so what I want to do is provide a quick opportunity for people to ask any questions. I think what comes next, it will be an outstanding question for many of us, but yeah, Dora.
Yeah, thank you so much, Diane. So my question is, there are some folks who have like back rent. So what do we do as organization to make sure that the rent is paid before the end of VERAP, end of November?
Okay, so if their application has been submitted and approved, then that back rent, if it's reflected in the application, will be paid out. So just make sure in the application when it says it could be either back rent from a prior unit or back rent from a current unit. Just make sure that's reflected in the programs page of the application.
So let me get it maybe clear. Do we have to do a new application for these
No,
3 remaining
no, you do not have to do, no, you can modify the existing application, even if it's been submitted, to reflect any back rent that's owed.
Okay, good. Thank you.
You're welcome.
And then Megan, I see a question.
Yeah, I'm just want to clarify for people who have submitted applications, but those applications have not been processed yet or approved. Will those still go through?
Yes, yes.
Okay.
The key to that is they have to be submitted.
Thank you.
And they have to have all of the documentation. I have not gotten clarity yet on if an application is denied due to missing information and the date goes past September, will they, how will they be processed for appeal? I don't have a lot of clarity
that would be
around that.
Very good information to have.
Right, and I can try and get that for you.
Thank you.
Yes, please. Thank you.
All right. Thank you so much. Oh, I've got one more.
So I have a quick question. There's a question in the chat about which agency you are from, but my question is that when you say until funds run out for those below 30%, do you have any idea approximately when that fund will run out?
I do not. I think that would be a question probably for Caprice Hover over at the Vermont State Housing Authority. I think she's got her finger on the pulse of that. I don't know.
Okay. And which agency are you from?
So I am part of what's called the Boots on the Ground. And we were contracted with the Vermont State Housing Authority to work on VERAP applications. So we initially worked on the backlog of applications that were in the portal that had not yet been submitted. We currently now are working with community partners all over the state to try and get their backlogs cleaned up, get applications submitted, provide any assistance that we can. So if any of you need assistance, we are available to help you, get through what we can by the end of September, and then even work on missing information beyond that.
Thank you.
All right.
And don't forget recertifications too. Recertifications are important. Make sure any client that has been receiving funds and is due for their recertification, that they complete that recertification so that they get their next round of funding, and there's no lapse there.
Great. Thank you so much, Diane. For the sake of time, I do want to move on and apologize that we will go late. Folks who need to leave early, please do so. This will be recorded, but I do hope you can stay. Really moving quickly, I'd like to introduce Deb Kitzmiller and the team that she's put together for this talk around family and maternal health. So welcome and thank you.
Hi, everyone. I'm Deb Kitzmiller. I work at the health department. I'll go into a little bit more of my role later in the presentation when I present with Adriana, who's also from the health department, but we're going to start off. Allison Wheeler from CIS is going to present. And Alex, did you, oh, you did give me permission to share screen. I see that now. And we also have planned for Autumn to speak at the end too. So let me go ahead and share my screen. Okay, can everybody see that?
I can't see a presentation right now.
You cannot?
No.
Oh, okay. Let's see.
There we go.
Okay, sorry about that. Okay, can you still see that?
Perfect. Thank you.
Okay, great. Okay, Allison, go ahead. And let me know when you want me to advance.
Okay. Hi, everybody. Thanks, Deb, for introducing us. My name is Allison Wheeler, and I am the Children's Integrated Services Coordinator here at the Winston Prouty Center. So I'll just start by saying that the PowerPoint that we're going to go through has a lot of information. I'm going to just summarize the pages, but hopefully this can be a resource to you afterwards, because each page does have some examples of reasons why you might make a referral to one of our programs. So you can go ahead and advance, Deb. So for those of you who don't know, Children's Integrated Services is a multidisciplinary team that is in each region in Vermont. So in Brattleboro, the Winston Prouty Center is the organization that has all of the CIS providers. We also collaborate with HCRS, Healthcare and Rehab Services, and the Visiting Nurse of Hospice of Vermont and New Hampshire as part of our CIS team. So our services are nursing, family support, early intervention, early childhood family mental health, and specialized childcare. And I'll go into a little bit more detail on each of those as we go through the slides. All of our services are billed through Vermont Medicaid. However, any family can receive services through CIS regardless of their insurance status. Families can work with us short-term and also long-term. So we have lots of families who just receive maybe 1 or 2 visits from one of our programs. And then we also have a lot of families who work with us over the course of several years. It all depends on what their needs and goals are. And our services are meant to be as much as we can provided in a family's natural environment. So in their homes, we also provide services in childcare programs. And throughout the community, if families aren't comfortable with us being in their homes, we definitely have families that come here to our building for visits. We meet with families in the libraries, really wherever we can to provide the services that they need. Referrals for CIS really can come through any door. So a lot of times people know a provider within CIS and they will give the referral directly to the provider. We like to say there's really no wrong door. And we also really like to encourage referrals to come even if you're not sure if we're the right program, because we will do our very best to connect families with the provider or the program that makes the most sense based on what's going on with the family. So next slide. The first program I'll just mention is our called our Sustained Nursing Program. So this is offered through the VNH, and the providers that do this program are just integrated right within our CIS team. So what this is it's meant to be more of a long-term nursing program for families during pregnancy and after pregnancy. So what they can get is up to 25 visits with the same nurse throughout that time. There's like a visit schedule they go through. And it's really a focus on the family's goals. There's a focus on, preparing for birth, parent-child attachment, child development, working with parents on their own individual goals, and supporting families through the transition. So they'll work with a family up until a child turns 2. And this program used to be just for first-time families, first-time pregnancies, but now it can be subsequent pregnancies. And the eligibility for this program is they have to either have Vermont Medicaid, somebody in the family would have to have Vermont Medicaid, or be income eligible for Vermont Medicaid. And they also have to enroll in this program during their pregnancy or until the baby is 6 weeks old. Go to the next slide, Deb. The other program that I will mention is our responsive nursing. And so actually we have one of our maternal child health nurses here with us today, Autumn Blaze. And so this program is meant to be more exactly what the title says, responsive. So it's not necessarily that longer term nursing. And so it's, we have nurses here on staff that provide support during and after pregnancy, and they can provide support with families who have children up to age 6. So again, it lists here some of the services that are included within that. So prenatal and postpartum care. Our nurses are lactation consultants, so they do a lot of support around lactation and feeding, newborn physical assessments, again, like anticipatory guidance and health teaching, making sure families are connected with medical homes. And I also listed on here some questions that might prompt a referral to responsive nursing. So I won't go through those. You'll see those on each slide, but hopefully that might be helpful for you afterwards if you're wondering about a referral to one of our programs. So you can go to the next slide, Deb. The other program is CIS family support, and I would say this is probably the most broad part of our program. So this is a support available to pregnant families and families who have children up to age 6. This can include lots of things. So it can be really just around basic parenting support and education, help families access or find childcare. Our family support worker does lots of things like helping families with budgeting, finding employment, finding affordable housing, or helping families address housing barriers and challenges they might have. Our family support workers also can help with accessing resources and benefits. So if families need help with applying for WIC or 3 Squares, for example, they can help with that. And then connecting also the families with, you know, mental health supports or substance use supports in the community. So really being a link for families to get the support that they need. Next slide. We also have an early childhood and family mental health part of our program. And again, this is a support available to families with children up to age 6. And we do have Maura Shader here with us today as well. And she's one of our early childhood family mental health clinicians. So this program provides support to families with children who are experiencing social, emotional, or behavioral challenges. So that can include clinical support for families and children who've experienced trauma, consultation and support around challenging behaviors that might be happening at home or in school, support with social skills and healthy social emotional development. And also our team can provide general consultation to child care providers and early education programs. And again, also connecting families if, you know, if they need additional services or supports, we can help them with that in this program as well. So there's questions again below as far as reasons that might prompt a referral to this program. And I would also mention that our early childhood family mental health team is working to expand the support that they're providing to provide more supports to families during the perinatal period. Next slide. We also have the early intervention program. And so this is a federal program that provides developmental supports for children. This is the one part of CIS that only goes up to age 3. So from birth to age 3, this team works with families who have children who have a developmental delay or who have a diagnosed condition. or who are at risk of a developmental delay. And so the early intervention team works with those families in their natural environments. They're working with the caregivers, with childcare programs to help support the child's development. So this can be specialized instruction around cognitive development, physical development, so including hearing and vision, communication development, social emotional development, and adaptive development. And so they also, if a child is still in need of continued developmental support, this team will help connect the family and make that smooth transition from our early intervention program to early childhood special education, which serves children from 3 to 5. Next slide, Deb. Last part of our program is our specialized childcare services. We have a specialized childcare coordinator as part of our team, and this is a program that helps families to access and get the support they need to find childcare and access financial assistance for childcare. So there's 3 categories that this program supports families with in terms of looking for or finding childcare. So if there's a family who has a child with a special health need, there's a particular form of financial assistance available to those families. Our specialized childcare coordinator helps families who have children involved with DCF family services, protective services. So families that are involved with them, there's a particular form of financial assistance and childcare support for those families, or children who come into DCF custody. She'll help find placements for those children. And then we have family support childcare financial assistance, which is really for families that are experiencing significant stress that's impacting their children's access to finding childcare. So we definitely help with that. And also at Winston Prouty, we just help families with regular forms of applying for financial assistance for childcare and childcare referrals. So if you have families who are looking for childcare programs that have openings, or wanting to get on wait lists for childcare, we can be a resource for that as well. Next slide, Deb. So also our specialized childcare provides support to childcare directly to childcare providers. So it helps childcare providers or programs to achieve specialized service status, so that they can place some of those children and have the skills and training they need for children who might be within those categories of specialized services, and general support to childcare providers, helping childcare providers with any questions they might have around CIS, family services, childcare financial assistance, transportation, and more. There's also a special transportation program available to families who are accessing specialized childcare services. So it can, our coordinator can authorize transportation for kind of a small subset of families if there's a barrier or a challenge to get their child into the program that they've been enrolled in. So next slide, Deb. So this is sort of just a quick summary. I know I've gone through this really fast because I know we're a little short on time, but our referral process really is, and I can make sure that Alex, you have our referral form. Our referral process, really all we need is verbal permission from a family. And so I like to say, you know, a family's not signing their life away. Really, they're just agreeing to a phone call to, you know, hear more about our services and talk through how we might be helpful. At the top of our referral form, there's a little box that gets checked off that says the family has given verbal permission for the referral. And as long as that's checked off, we will contact them and have them go through our intake process. Families can always self-refer to us as well. And I put our contact information both for myself as the Brattleboro CIS coordinator and for the Bennington CIS coordinator, that's Kelly Belleville. And the CIS program in Bennington is through the Sunrise Family Resource Center. I also put some links here for the Winston Prouty website and the Sunrise website, and also the Child Development Division, where you can find more statewide information about children's integrated services. The other thing I just forgot to put on the slides and mention is that we do also have what we call the New Beginnings Postpartum Wellness and Support Group that's run by our maternal child health nurses here at Prouty. And that's a weekly group held here at the campus on Tuesdays from 10:30 to 12. And I'll make sure to get some information out about that as well. So I guess the biggest thing, I try to say the biggest takeaways for you about what CIS is and how we can be collaborating with you is we provide a wide array of flexible and responsive support to pregnant people and families with children up to age 6. So if you have if you're working with a pregnant family or families with children up to age 6 that you think could use some support, think of Children's Integrated Services. And again, there's no wrong door to access support. So if it really isn't a CIS referral, we will do our best to help connect you or the family with the appropriate organization. So again, I know that went really fast. I'm going to pass the baton over to Deb.
Okay, thank you so much, Allison. When Alex asked us to present on maternal and child health, Adriana and I chatted with Allison and Autumn, and we thought it made sense to kind of start with CIS because CIS really covers so many services in this area with families, pregnant people, young children. So now we're going to kind of pull the lens back a little bit and talk about maternal and child health on a little bigger scale and how it fits into our work at the health department. So I thought that I would start with just making sure that everybody has like a basic understanding of how the health department does work in the state of Vermont, the fact that we have our 12 district offices, and then we have our central office in Burlington. So each of the district offices is, I would say, somewhat similar. So Adriana works at the Bennington district office, and I'm at the Brattleboro office. And each of our offices, we have our public health nurses. We have nurses that work with immunizations. We have nurses that work in maternal and child health, such as ourselves. And we also have nurses that work in infectious disease. We have other staff members that work in the WIC clinic, which we'll talk about later, and chronic disease and emergency preparedness. So, and I wanted to just kind of give you a feel for the relationship between our central office and the district offices is such that we have like program management, of course, happens at our central office, and they're, kind of sends information and programs down to the district offices. But in the district offices, we're really kind of the eyes and the ears on the ground. We're in the community, we know the community, we work with the community partners. So not only are we sharing the information, out to the community, but we're also trying to maintain an awareness of how the systems are working. So for instance, if we hear that people are falling through the cracks in a certain area, we're going to hopefully communicate that up to central office. So this is an important part of our work. So this meeting is like it's an example of how we kind of get a feel for how things are going. So just wanted to kind of put that out there and give you some perspective for the work that Adriana and I do. So now I'm going to go a little bit more into some specifics about ways that we work with families with children. So we have our WIC clinic here, and Adriana will be going a little bit more into WIC, so I won't spend a lot of time on that. Another program that we have is called the Breastfeeding Friendly Employers Program. So we can work with employers in supporting their breastfeeding or pumping or chest feeding staff. So we can help them develop policies, make sure that they're providing, the physical space and the time for their staff to maintain lactation. We also work with schools. So one of our public health nurses is a school liaison. So she's collaborating with the supervisory unions and organizations across Windham County in the case of the Brattleboro District Office, but to improve the health and well-being of school-age children. And then we also have a social worker that works with a program called Children with Special Health Needs. So that person is coordinating care for children with special health needs from birth through age 21. I already mentioned that we have our immunizations nurse as well. Generally, our immunizations program at the local health office, generally that's seen as kind of a gap filler. Like if someone doesn't have a PCP or health insurance and they need a vaccine, they can contact our office and we may be able to fill that gap for them. And then to go a little bit more specifically into some of the work that Adriana and I do. So we are trained in many health topics that have to do with maternal and child health. And we share this health information with providers. So that could be pediatric medical providers, obstetric providers, mental health, and other community partners. So we're sharing information on topics such as breastfeeding, infant safe sleep, substance use in pregnancy, smoking in pregnancy. These are just some examples of topics that we have expertise in. And then there's also some specific programs. There's one that's called Help Me Grow that Adriana will go a little bit more into that we promote in the community. So these are some examples of the work that we do. We don't work directly with patients or clients, or I should say not usually. We do occasionally have direct contact with, you know, the people that are living this experience, but usually our work is more systems level. I also just wanted to mention our website at healthvermont.gov. There's a lot of information and resources that could be relevant to this group. There are some translated materials. I put a couple of examples up on this slide. There's our lead page, excuse me, has recommendations for testing children and for refugees and new Americans. Of course, we have our COVID-19 information with information on testing and vaccination clinics. There's also a refugee health page that has links for translated health promotion materials. And then this slide here is really kind of a tickler for me to just throw out there that for the Brattleboro district, I do maintain a document. I shared it with Alex, and I believe Alex will share it with all of you afterwards. It's just an informal Word doc, but it provides an overview of additional maternal and child health supports in the Brattleboro district, because really there's so many things that can be helpful, you know, in addition to CIS, like Allison was talking about. In the Brattleboro district, we have our parent-child center, which is called Early Education Services, and they provide many supports, like a home visiting program and classes. There are Facebook pages that could be helpful. There's the doula program at the hospital. My point being is that there's really a lot. And I just wanted to let you know that, you know, in addition to CIS, you can always contact me or Adriana if you have any questions about maternal and child health. If you can't figure out where to go, you know, for help, for services, you can always contact us. And Alex, you'll share that document afterwards, right?
Yep, and I'll include it in the minutes.
Okay.
I posted it in the chat a little bit back as
Great.
well.
Oh, thanks. Okay. All right. And now we are going to transition over to Adriana.
Wonderful. Thank you, Deb. So for those of you that don't know me, my name is Adriana Tomasi. I'm one of the public health nurses at the Vermont Department of Health in Bennington. I apologize. I'm going to talk kind of quick just for the sake of time. I'm going to talk about two programs that are really great resources for families. One of them being the Women's, Infants, and Children's Program, also known as WIC. So WIC provides food benefits, education, breastfeeding support, counseling, and referrals for pregnant Vermonters, parents, and caregivers with children under the age of 5. So the focus on WIC is really 4 core services. This includes education, breastfeeding support, referrals, healthy foods. WIC is really unique with the exception that they really focus on nutrition education. Each participant receives a WIC card that they use at the grocery store, just like a debit card. It has a unique food package that depends on the age of the child or if it's a pregnant Vermonter. So for example, a 6-month-old is going to have a very different food package than, say, a 4-year-old child. The food package comes every 3 months. So at the first day of the month, you get the package for the next 3 months. Deb, you can go to the next slide. To qualify for WIC, participants have to be a pregnant woman, a mother of an infant up to 6 months, a breastfeeding mother with an infant up to 12 months, or an infant or child up to the age of 5 years old. They also have to meet income guidelines, which are on the website, and be a Vermont resident. If a participant has Dr. Dinosaur, Medicaid, Reach Up, or 3 Squares Vermont, they're automatically income eligible for WIC. To maintain eligibility, WIC appointments are scheduled about every 6 months. There is also a nutrition activity requirement. This can be found online. They need to have 2 activities every year. So between appointments, they want you completing an activity. Deb, you can go to the next slide. The easiest way for people to apply for WIC is to call whatever office is closest to them. So like I said, I work in Bennington. Our number's on here. Our WIC staff is great. I cannot say enough good things about them, and I'm sure Brattleboro is the exact same. They're available to help people apply, troubleshoot any problems with the card, talk them through the food package. They even go shopping with families, which is really helpful. Our website also has a lot of really helpful information for families. Next slide. The next program I'll be talking about is Help Me Grow. Help Me Grow builds and maintains a network of community resources across sectors and coordinates services across the network. So it's a free program for parents and families with children up to the age of 8 years old. They have a ton of resources. So it's a really good way to just call really quickly. If you have a quick question, they can connect you to services. It's available to connect a parent or caregiver to developmental resources and services, request information on child development, refer a family for developmental screening, all sorts of stuff they can do. Next slide. The best way to contact Help Me Grow is to have families call 211 extension 6. They can also text Help Me Grow Vermont to 898-211. There's an email address. And as long as service providers have permission from families, they can fill out an online form, which is also really helpful. And next slide.
I think that's the
That
last
might
one
be
I have.
it. Perfect. So yeah, any questions, please reach out to Deb or myself. I know it's a ton of information in a very short amount of time, but we're available to help with questions.
Thanks, Adriana. And then I believe we're transitioning to Autumn. So I'm going to stop sharing my screen.
Hi, everyone. This is Autumn. Can you hear me?
Yes.
Okay. I also
Thank
will
you.
be pretty quick. I know we're late. This is about CIS nursing, and I just wanted to let you all know what sort of specifically we've been doing with Afghan families. So we've been working with them for about 9 months. We have 4 current families, 2 referred about to start with us, and a couple referrals coming in. Most of our referrals are from the obstetrician. We have 1 who's self-referred so far. But like Allison said, we take referrals from any source. The services we've been providing include prenatal support, childbirth preparation, postpartum support like lactation, maternal recovery, newborn wellness, screening for maternal postpartum depression and anxiety. We do home nursing for their other children under 6. We do both acute and routine check-ins. We work with OB, pediatricians, moms, PCP, and other providers like physical therapy. We sometimes accompany people to visits. We do medication management, health education. We coordinate with ECDC and community volunteers to help them access supplies, resources, other referrals. We help them learn how to use WIC effectively. And then we do everything else that comes up during a visit, from reading their mail, helping them investigate childcare, answering questions about job searches, helping them figure out some banking. It's a lot of needs come up when we go into visits and go into people's homes. The things that I've noticed most so far have actually probably been spoken about a lot already, but financial literacy, transportation, language is huge, life skills. And for me specifically, there's a lot of health education, including like what are bacteria, what are hormones, lots of concepts that are difficult to translate. So that's been my experience so far.
Great. Thank you so much. Again, apologize for going over time. I budgeted for an 1.5-hour meeting and realized the invite said 1 hour. So that's my fault entirely. But thanks to those who stuck by. I will say, as the parent of my 6-month-old, our first kid, we've benefited so much from these services, and we learned about them through a friend. And so that was something we were able to do. But for new Vermonters who may not have that experience or knowledge of these programs, it's just so important that we all know they're available, because they've helped us along the way. So I thank you all for presenting and sharing this. Absolutely, we have time for questions. As long as folks are willing and able to stick around, I think that would be great. So thank you. Yeah, Grace.
Do you want to limit the number of questions I ask, Alex?
If folks have time and it's helpful to our community, fire away.
Okay. Adriana, WIC, nutrition activities that are required alternating every 3 months. Are those accessible to people who speak Dari or do not read?
I believe they do have translated materials. I'm not sure if Dari is one of those, and I apologize. They have a whole list of activities on our website. It's WIC, healthvermont.gov/WIC. They can also call the office as well.
Okay, so if they call the office, you can provide alternate activities for them in a foreign, in Dari or other language.
WIC staff should be able to help with that.
Verbal.
If not, let us know.
Verbal, not written. It's got to be verbal.
They should be able to help with that. Just let us know. If not.
Okay, thank you. And Allison, do you know if the sustained nursing and responsive nursing CIS programs are available also in Bennington County? Because I work in childcare and I haven't heard of them before.
Yes, they are. The CIS services are available in all the regions in Vermont. And so in the slides that I sent, you would have the information for the CIS coordinator in Bennington, Kelly Belleville. So she should be able to give you more information. I will say the CIS teams look a little different within each region in terms of how, some regions, the providers are in several different agencies, and they collaborate together. So she can give you a little bit more detail in terms of how it works in Bennington. I think what's a benefit here, I guess, in Brattleboro is that at Winston Prouty, all of our CIS providers are really under one roof, even though we're collaborating with HCRS for the clinical part. Everybody can be found here in our building. So, but yeah, you should definitely be able to access nursing services through CIS in Bennington.
Okay, that's great. Thank you, Allison.
Right. Any more questions from folks? Great. Well, thanks again. I appreciate everyone sticking around for the late meeting. I will send out the recording and PowerPoints and resource sheets along with the minutes by the end of this week. So thanks again to our presenters and for those who stayed to listen. I really appreciate your time. Have a good Monday, everyone.
Thanks, everybody.
Thank you.
Thanks, everyone.